we have the signatures or the carbon makings of organic creatures. I remember one time seeing a sign, organic, which your parents used to just call food.
That's where you're getting like mitochondria level. You're getting that high cellular repair, good detox.
We are treating patients with non-healing wounds. The common denominator with all of these indications is typically ischemia.
Studies have shown that 60% of the human's biome is from bacteria, from the soil. 40% is genetics. Show me where, Gary Brecka says this famous. Show me where in the genetics you think this is from. Good afternoon. I'm Dr. Ludwig Stardarian. I'm a board-certified anesthesiologist and the Chief Medical Officer, Vice President of Medical Affairs at Frederick Health Hospital. I want to also introduce my two colleagues here at the table.
Hi, I'm Chris Wood, a board-certified integrative health and wellness nurse, and I am the stroke coordinator here at Frederick Health.
Hi, I am Dr. Narayan Kulkarni. I am a board-certified wound and hyperbaric medicine specialist here at Frederick Health.
And we want to welcome you out there in the community to our podcast called Wellness Wired with two docs and a nurse, where we discuss topics related to healthcare, to biohacking, to some of the frontier discussions on supplements and maybe controversial topics that are out there on the web and either validating or invalidating. And with that intro, we'd like to also say that all of the topics we discussed today are for discussion purposes only. We are not advising direct medical care. If you do seek any type of methods that we're discussing today, please always correlate that with a provider of some sort, a medical provider that knows your health well, and follow their guidance for that. With that being said, welcome to Wellness Wired with two docs and a nurse.
My first dive into wellness and mindfulness was back in college. I took a yoga class as my gym credit and completely fell in love with it. It was exactly the yin to the yang of nursing and biology that I needed, and it was amazing.
For me, I think it goes all the way back to when I was a teenager. My brother was reading a book on the Buddha called Siddhartha by Hermann Hesse. And after he was done, I read it and was completely interested in the whole concept of meditation and what it does for you and all the potential benefits for it. And that was a natural tie-in to my interest in medicine altogether. And that's how I started that journey.
Yeah, for me, it goes back to high school and college. I was a neurobiology major and was always fascinated by the mind. I initially wanted to go into neurosurgery or neurology, and then was fascinated by what anesthesia does, so I entered that field. But the more I study the mind and how powerful mindfulness techniques are and how boundless the mind is, the more I want to study wellness in an organized fashion to say, either through supplements or sunshine or certain behavioral change, you really increase your capacity for happiness, joy, and that's how I got into it. It was kind of an incremental seeking of more knowledge. Well, welcome to our first podcast, Hot, Cold, and HBO, where we'll be discussing cold water immersion, or cold plunging as they call it, hot sauna therapy and the benefits, and then hyperbaric oxygen treatment and what it's for, what it's being used for, and what it may be used for in the future. I'll take the first plunge, if you will, into the cold plunging. That's really, I think, you see a lot of videos now out, especially on YouTube, and it's being called cold plunging, but it's really cold water immersion. It's been primarily used in the past in athletes and high performance individuals, but now it's really gaining a lot of popularity, especially with access to these tubs and access to do it, and it's a bit of a movement. And I wanted to talk about, personally, I have been plunging now almost 8 months, 7 months, and a little bit of background about myself, which may argue against some of the arguments and disclaimers about not doing it. I have had open heart surgery twice myself, and I've had the good pleasure of living with arrhythmias most of my life. So anything that will decrease inflammatory triggers to arrhythmias is a winner in my book. And many medical efforts have been tried with medication and ablations to fix it and haven't worked. So I tried cold plunging and successfully have actually reduced, if not extinguished, all the arrhythmias. And so the main reason cold plunging is used, or cold immersion, is really for inflammation reduction and muscle soreness. And typically what the recommendations are anywhere from 50 degrees Fahrenheit to 6 degrees Fahrenheit. And the recommendations start slow, 1 to 3 minutes, and maybe extend to 5 to 10 minutes at most. Unless you're an advanced plunger, as they say, which I feel like I may be now, it's not recommended to go below 40 degrees, but some people, it's the shock behind it. I'll go into some of the benefits that have been shown besides from the inflammation, and go into a little bit of the science, and I would love to hear your thoughts on it since you're going to be doing the hot therapy component. But I personally can validate the evidence out there that it does induce better sleep, better quality of sleep. There have been studies that have shown a 250% increase in dopamine immediately after being in the plunge. And in many ways, there is studies and evidence showing that by going through the process of sitting in cold water, you are building resilience and grit. You are inducing a sympathetic response that wants you to get out, but you're saying no. And there are cold shock proteins that get released that are very beneficial to, again, resilience, to the immune response, to liver function, to insulin sensitivity, that cravings you may have at nighttime. And so a lot of benefits I've seen. I think some of the arguments against it that I've seen is, if you have a bad heart, or if you're elderly, the shock can be bad. I'm an N of 1 with a bad heart, and it's been hugely beneficial. Again, we started slow, but have gone to some extreme temperatures now. But the mental toughness through controlled discomfort, that's what I love. You know, no one wants to get into cold ice water, but you do it and you find a calm in there. And that discipline, I think, has benefits. And I think I have felt a overall mental clarity that I would not have through just sleep or being on the beach or relaxing. I would love to hear your thoughts about it. I feel it's beneficial to all comers. I know there's arguments that it should be only for certain pockets of individuals, but my boys do it with me, and they're young. They're 15 and 12-year-old soccer athletes, and it definitely is addictive, which is likely the dopamine release component. But we do not miss a night without doing it. Just the positive effects on mood and metabolism is huge, and it's being studied pretty heavily now. Most of it is meta-analysis, not a lot of randomized control studies just yet.
So I so wanted to counter everything you said. I will say, though, anecdotally, as another N of 1, I post surgery for an ACL tear used a dry. I didn't do the water cold plunge.
Yeah.
I used a dry cold tank, a dry air cold tank, and it was fantastic in reducing inflammation and pain for several days after. So that is good. The counter is, the biggest counter is the heart issue.
Yeah.
I think I was telling Dr. Kulkarni that I was researching, trying so hard to find good counters, and American Heart has on their page, it is an article titled, "You Are Not a Polar Bear. The plunge into the cold has risks." And a lot of that is, it's that sudden into the really cold, that shock can cause an arrhythmia. And I think it's compounded with other issues too, you know, and if you don't have good compensatory mechanisms in place, you do run a risk of causing an issue. It is really cold, so persons with neuropathies, Raynaud's, or maybe a bad wound neuropathy, or diabetic neuropathy, where you're not really able to have that good sensation of, are my limbs really getting too cold, would be another kind of contraindication. Another, obviously, is pregnancy, but kind of even in those childbearing age range, women tend to be less tolerant of the cold in general. And so sometimes you're getting that, the endorphins hit, but that adrenaline rush can actually cause an increase in cortisol as well. So you're kind of countering what you're trying to do. And some people are really sensitive to that adrenaline rush. So they get that high for a moment, but then after they're just done for the rest of the day. So that kind of coming off of that high really it is like a low point. So you're kind of countering some of the positive that you want to do. So I guess those are my biggest counterparts. What do you have as like?
So one question I have for you is, I assume that you would need to absolutely have that plunge in order to get that dopamine and norepi surge. Would it be possible to potentially reduce the risk of arrhythmia by getting into water that wasn't as cold and then gradually drop the temperature over a certain period of time? I assume you probably wouldn't get that norepi and dorepi, but because you would still get that vasoconstriction over time, which is a significant benefit.
Yeah, there's the vasoconstriction and then the warming up vasodilation. That's
Correct,
really
which is
beneficial.
outside. Right.
I think the shock is really critical, and it is the cold shock protein release that ends up being the immunofactor that's very beneficial, and the circulatory assist. So you can't, unfortunately, slowly get cold. The goal is to get a shock and come back. Interestingly enough, from a cardiac standpoint, from a heart standpoint, I can see where so my arrhythmias are tachycardic arrhythmias. My heart goes too fast. So when you get into cold water, your heart wants to slow down. So it's a vagal response. So I can't slow down enough. So I would say I agree with you somewhat that if someone has a bradycardic disease, and they need a pacemaker or they're working a pacemaker, maybe a cold plunge is not good for them because it could slow them down too much. However, I think by and large, we live in a society where most people are in sympathetic overdrive. Most people have high heart rates, and they're all on metoprolol and atenolol to slow the heart, to slow the pressure, to lower the pressure. So that's why my argument is cold plunging really, really does benefit most everyone. Now, 55, 58 degrees, I don't think generates a shock that really is lethal in my opinion, and I've started from 57, I do 37, 36 now. So I think it's the range in which you do it, and so yes, I think it has to be a shock, and you have to really not want to do it. That's the resilience, grit component to it. Yep.
I do have a question for you.
Yeah.
So I was reading that there is some school of thought that if you wash your face in that really just ice cold water, because of the receptors across the forehead, that you're getting that same.
Yes, Valsalva.
Which I prefer much better.
Yes.
So I do try to wash. That's my cold plunge every day. I just wash my face, and try to stay in the cold. But I don't know that I'm actually getting the same benefit.
Yeah, I mean, there's been studies to show that if you just put a bowl of ice water and just put your head in, you will induce the vagal response in a similar fashion, and induce a somewhat of a parasympathetic or anti-sympathetic state. I think this is an extreme form of that, where you're immersing your entire body. There is no, in fact, the extreme folks like I have become now, first you put your head in for a few seconds and then you sit in it. So your entire body is now cold. And the goal is to really get your body temperature to a low point, so you are really mimicking a parasympathetic state. But putting your head in ice water helps as well.
I also read some research that you can actually increase brown adipose tissue activity
Yes.
with cold plunging.
With shivering, typically the more you shiver, the more adipose tissue you tend to break down.
So I did have another question. Actual cold plunge water versus using like a cold tank where they use nitro or some other form of cold air. Difference between the two, one more beneficial than another?
I have not seen any difference. Again, it's really a conductivity issue there, whichever one feels cold. I think the latter is an access issue for people, right? Not everyone's going to have those type of tanks to get into, whereas water, if you have a tub and you have a couple bags of ice, you can try it out, and then you can get a chiller for a relatively decent price, and so it's more accessible. But I presume all of these different techniques ends up being how your body receives the shock and how it tolerates it. To your point, if someone is receiving it as a painful stimuli and their stress hormones are being shot up because they feel like it's torture, maybe in the long term it's not good. But if you are getting the dopamine rise, regardless of which modality you use, or you feel better sleep, you're healing better, your heart rate's lower, you're not getting those mental fog periods, then it's all good, regardless of which one you go with. It is very calming to lay in cold water. I will tell you that if you haven't tried it. Very serene, with some music.
Yeah, I don't have the same sensation at all.
What are your thoughts on sauna though? Like heat sauna?
You can relax.
Yes.
A lot. So heat sauna, two different forms as well. You know,
Right.
kind of the traditional hot stone warming the air, or using infrared, which I personally use, and that's, I guess, kind of my favorite form. It's easily accessible. You can have it in your house, quick and easy to kind of start up the machinery. So it has all three, near, mid, and far infrared. So you're looking at penetration through the skin.
Right.
Surface level, that's things like skin.
Yep.
My daughter last year started with really bad acne. We did the sauna with the red light. That's, you know, part of the sauna, and immediately cleared it up.
And that's the 650 to 800 nanometer range you're looking for?
You're looking for. Then your mid kind of gets a little bit deeper into your tissue. You're looking at some like soft tissue repair, some general wound healing, those kind of things. And then your far really gets deep into the cell. That's where you're getting like mitochondria level. You're getting that high cellular repair, good detox, detoxification, reduction in oxidative stress is really, really like the big
Right.
benefits of the sauna. So generally about 110 to 130 is the temperature for your sauna. They recommend, same as cold plunge, you kind of want to start low and slow.
Right.
I have saunaed for years, so I'm 135, 140 for about 45 minutes.
Wow.
And I have that same euphoric, like
Sure.
you walk out and you just feel like a new human. So things that I've seen anecdotally with patients that I have treated, improvements in POTS symptoms, which seems kind of contradictory
Yes.
because of that increased heart rate and decrease in blood pressure, but it really does seem to help to balance out that sympathetic response. A lot of pain, joint pain, muscle pain, fibromyalgia pain seems to be improved. Also, at that kind of at the near and mid range, you get a white blood cell response in the, that's your tissue repair, so in that surface level. So things like cold and flu, you
Right.
can kind of shorten the length and
Right.
sometimes even mitigate getting a really bad infection. So we did see that a lot with clients. Not good for everyone. There are some people that are very heat intolerant, so that wouldn't necessarily be good for them. Although the infrared saunas tend to be a little lower in temperature
Right.
than the stone, so a little bit better for someone that may be heat intolerant. Again, pregnancy is something
Sure.
that you'd want to avoid.
And what's a time interval that's recommended in the stone?
Generally, around 30 minutes is
Okay.
usually our max. 15 to 30, kind of depending on how comfortable and new you
Effective.
are.
So effective is 15 minutes.
Effective,
Yeah.
yeah. And so pretty quickly, especially for that detoxification.
Right.
Any medical contraindications?
Really low heart rate, low blood pressures, because you're vasodilating so much.
Yes.
So, you would definitely want to be careful there. Kind of something else to keep in mind when you're doing it is you're sweating out all of the
Dehydration.
Yeah, so dehydration is a big piece. So making sure that you are, staying really hydrated, and also having a towel or something to wipe off, because you're releasing all sorts of toxins through your skin. You don't want to reabsorb it, right?
Oh,
So as
interesting.
you come out and you get chilly, and then you reabsorb everything. So wipe it all off before you
interesting.
come out, and then shower pretty quickly after.
No, I've read that being in the sauna with such a redirection of blood supply to the skin, that you actually get a little bit of hypoxia to the deeper tissues. Did you find that?
Anecdotally, I haven't found that, and I haven't seen that in the literature, but I think it would be interesting because we're, especially with those far wavelengths, you're really getting so deep into the cell. So maybe some, I don't know, that's a good question. Maybe some of that, like cellular repair and like cleaning out, that would be a good place to kind of clean out those dead cells.
I'm kind of gathering a common theme in the contraindications of both. You know, I think when people say if you have a heart problem, don't do either, I'm getting a sense, again, as an anesthesiologist, I think of things from a cardiac respiratory risk standpoint. I think patients or people that have low heart rates that are dysfunctional, right? There's people that are very healthy at 40 beats per minute. But if you have heart failure, or you have low blood pressure because of a cardiac dysfunction.
Heart failure is actually one thing improved. Like there
Really?
are studies from Mayo Clinic that they put heart failure patients in the sauna.
In the sauna.
Yeah.
Interesting. Wow. Which would be counterintuitive because of the vasodilation and the need for more cardiac stroke volume. Yeah. So yeah, some of this is counterintuitive. Again, for me, if someone said pretty bad tachyarrhythmias, SVT, heart rates in the 200s, go sit in ice water, it's a great idea. I would be like, I don't know if that's a great idea. But I did, and it's actually worked out in a counterintuitive way to solve the problem. So yeah, so it's interesting.
We have the same contraindication in HBO therapy in terms of congestive heart failure, but there you're actually getting systemic vasoconstriction. So you have to worry about that as well. Yeah.
So hyperbaric oxygen therapy, that's really the craze now. I'm very intrigued by it. Well, because one, I'm very intrigued from a traumatic brain injury tissue repair standpoint, because I think there's a lot of research coming out. But also, I've had open heart surgery twice, so I've got a lot of scar tissue leading to arrhythmias, and I'm intrigued by if neural tissue is repairable, can cardiac tissue be repairable if I sat in a chamber for the 60 sessions for, how many weeks? So.
Sure. The answer is undetermined at this time right now. We basically need to do a lot more research on that sort of thing. But to basically give you guys a primer on HBO therapy, what it is. So HBO stands for hyperbaric oxygen therapy. So it's basically high pressure oxygen. Patients go into a special kind of chamber. There are two types of chambers. There's monoplace chambers and multiplace chambers. The monoplace chambers, what our hospital has, but most hyperbaric centers in the country have. And then there's a multiplace center at the University of Maryland where multiple patients can go in at once, and it's kind of like a little submarine. And patients basically get treated at once, and instead of going into a chamber, they wear a little mask over their head, and then the entire room is pressurized. So the entire pathophysiology, basically what you're doing is when these patients are breathing in 100% oxygen under pressure, we take them to about 2 to 2.4 atmospheres depending. You can go higher depending on the indication, but typically most of the indications are within that range. It's equivalent of about 30 to 50 feet of seawater, and then the oxygen dissolves into their bloodstream at much higher concentrations. So right now we're at about 100 millimeter pressure, just breathing 1 atmosphere, 21% oxygen. But you take them into the chamber, and their partial pressures are going to go up to 1,800, 2,000 millimeters of oxygen. So that does a lot of things. Now, as you remember, I'm in wound care, so we are treating patients with non-healing wounds. So these are diabetic foot ulcers who have peripheral vascular disease. These are patients who have radiation injury. These are patients who have compromised flaps and failing flaps. The common denominator with all of these indications is typically ischemia. Now there are 16 different indications in HBO therapy, but for these particular indications we're looking at ischemia. You can use HBO therapy for decompression illness as well. That's where you're kind of more using the pressure component and squeezing the nitrogen bubbles down so you can exhale them. You can use it for carbon monoxide poisoning as well, which is also a separate mechanism. But in this particular case, here at the Wound Care Center, we're primarily using it to treat ischemic conditions. And what it does is just when the oxygen is dissolved into the bloodstream at these high concentrations, you are stimulating a lot of the cells that are responsible for regeneration, producing new blood vessels called angiogenesis, for stimulating all of the construction worker cells, basically the fibroblasts, the macrophages and PMNs that are responsible for the first phase of wound healing. So there's a lot of additional cells. Stem cells are mobilized in incredible amounts, and they're actually sent to the site of the wound. So there's a lot of remodeling that goes on during therapy. Like I said, there's 16 different indications, but it's pretty amazing. And like you mentioned, there are CMS approved indications, which is what we treat, and then the off-label indications, which is the subject of a lot of research. And two of the big areas of interest right now are traumatic brain injury and cognitive effects. Traumatic brain injury and cognitive effects. There's a lot of research in that right now to see if there's any potential benefit. The cognitive, so that's still being studied. There's a researcher in Israel that just recently came out with a study last year, or actually a couple of years ago, where he found that treating patients with HBO every day, 5 days a week for about 2 months, they had a dramatic reduction in their telomeres, actually not lengthening of their telomeres.
Wow.
So yeah, so their telomeres and their natural killer cells and their T cells and B cells actually lengthened. And it's if you know about telomeres, you know, it says like it is the telomere length that actually tells these cells to become senescent or to basically start the programming to basically die.
Yeah.
When you're lengthening the telomeres, what you're doing is you're actually reducing the effects of aging.
So for
There's
our
a lot of studies on the length of telomeres. and
Yes.
how that is a direct correlation.
Absolutely.
With all cause and effect.
and for our audience that maybe took genetics a long time ago or didn't take genetics, telomeres are the tail ends of the DNA of the chromosome, and it's actually a Greek word meaning the ending. And so there's a direct correlation, absolute direct correlation between telomere length, how much you have left on your chromosome endpoints, tails, and when you'll die.
And it does naturally shorten.
It shortens through degradation, but there are holistic approaches that actually will re-lengthen them. So you want to talk about a fountain of youth, someone who figures out telomere lengthening is going to literally figure out how to have people live into the...
There have been several mice studies on it, but there is a limiting factor. And I don't remember the exact length, addition, but after a certain point, that tips to cancer.
Right.
And so then you kind of get that
In this
other
particular
side.
group, it was like 40 patients, very small trial. So obviously a lot more research needs to be done. But the startling statistic, and it was statistically significant, and it was sustained 40% increase in the size of the telomeres in their NK cells and their T cells and B cells.
When you're in the chamber, do you feel the pressure in the ear canal? Okay.
So basically what happens is when they're in the chamber, they're going from 1 atmosphere to 2 atmospheres. So it's just like diving in water, like down to 33 feet or 50 feet.
membrane.
Right, so that pressure is going to be pushing on their eardrum, on their tympanic membrane. So we basically teach them how to equalize here. So I just tell them it's just like landing in an airplane. So whatever you do when you're landing in an airplane, some people swallow water, some people kind of pinch their nose and blow and try to equalize that. So they need to be doing that on a regular basis. As long as they do that and they maintain it until they get to pressure, then it's not going to be an issue. Some patients end up needing tubes because they can't deal with that ear squeeze. It's called ear squeeze.
Right.
So it can be difficult for them. But the vast majority of patients do just fine. Yeah.
I have a question on the lung piece. So I have a genetic lung issue that I've dealt with forever. But I've heard that I should never go diving. I should never, and so I feel like this would kind of be like another piece of that. Is like, how does lung health, assuming that many of your patients are probably very comorbid with multiple issues, particularly lung-related issues.
Pulmonary pressure.
Absolutely. So whenever we do an evaluation for a patient, you're absolutely right. Most of these patients, these are non-healing wounds, so they're typically elderly, they typically have cardiac issues, pulmonary issues, diabetes, that sort of thing. So I pay special attention to cardiac, pulmonary, and neurologic issues. Those are the biggest things that can happen in the chamber. For lung issues specifically, what we really focus on is COPD. So if you have a long history of smoking where you may have pulmonary blebs, which for our audience are basically the little lung sacs that basically enlarge because of the change of COPD, and then they start to meld together. And when that happens and you can't ventilate those independent sacs, then there's a potential chamber of something called a pneumothorax. So we look for COPD issues and we work that up to make sure that they're going to be safe to dive in the chamber. We ensure that there's no other like uncontrolled asthma where there might be some air trapping, which can also potentially cause a problem in the chamber. And then cardiac-wise, we look at congestive heart failure because the oxygen to the brain will try to protect itself from excessive oxygen because that can cause seizures, so it'll actually cause vasoconstriction. And as a result, if somebody has advanced congestive heart failure, that could put them into flash pulmonary edema. So those are the things that we focus on, just to basically keep them as safe as possible in the chamber.
Have you ever experienced the treatment yourself? Through training, do you have to be in the HBO chamber? Never?
No, I have not as yet, but I plan to one day.
It's a fascinating approach to healing. You know, again, similar to you, I have a pulmonary issue. I've had pulmonary valve stenosis as a child, had it repaired, had it re-repaired 7 years ago. So my pathology is right on the pulmonary valve, and so all of the arrhythmia, electric tracts that have gone haywire are right around that pulmonary tree. So of course you add high concentration of oxygen and high pressures, that puts pressure on the pulmonary trunk. However, I'm curious to see if that would heal it because of the oxidative efforts that are taking place, or suddenly you're in there and you feel the arrhythmias because you're feeling the back pressures potentially.
Right. Yeah, there's still a lot of research that needs to be done, and if this is an ischemic nature, then absolutely. And so the question is this remodeling secondary to ischemia? Is this scar tissue development, or is this just how we heal?
Yes.
Right. And when we heal, we do get scar tissue, and that scar tissue often is ischemic right down at the cellular level, right? So if that's the case, then yes. So is it a CMS approved indication?
Right.
No.
Or
but can we potentially get benefit of it?
Post open heart valve patients all get HBO.
Yeah.
Maybe for scar tissue in the immediate, before it actually scars over. But my question is, because the heart isn't able to regenerate itself, right? We talked about my post-COVID heart issues, which probably stem from the original lung problem. That's always damaged, right? Once you have a heart attack, right?
Sure.
You have to create collateral circulation around that, but that never regenerates.
Right.
So would there be a benefit? I can see in the acute stage, but later, would there be a benefit from a heart standpoint? Because
stem cell stimulation.
Yeah, it is possible.
Okay.
Again, there's been no research. It's been looked into, but there is no research to date to demonstrate that. I think theoretically the mechanisms are there. I just don't think we have enough trials to show it.
What's intriguing with all three of the treatments we're talking about, I feel like the downside, right? Again, and as an anesthesiologist, we're always trying to figure out the risk and the downside. I feel like the downsides of these treatments, the hot, cold, and HBO, are relatively low, right? They're not non-existent. There's definitely risk associated, but getting into a cold plunge at 57, 58 degrees, I don't think is a very dangerous thing to do. Getting into a sauna, I don't think is a very dangerous. And then if it's indicated, or even off-label, if it comes down to where folks are doing it, I think these are therapies that are very promising in the future. And the more we start to understand specifically mitochondrial function, ATP production, another one of the big components of the cold shock proteins, specifically something called RNA binding motif protein 3, which is really what cold plunging generates, is it just causes more ATP to be produced. And so that's why you feel this rush of energy. Part of it is related to the sympathetic response, but I'm intrigued that, if you were to create a scenario in the future where folks were able to get a cold exposure, get the hot, and then get hyperbaric.
Vascular pump.
Yes, and then obviously you have to live a healthy lifestyle, right? You can't do all this and then be putting inflammatory food in your body and drinking too heavily or smoking. But if you're on the by and by, what an amazing life you could have, especially from a mental clarity standpoint.
So I should I'm sorry.
No, go ahead.
As far as hyperbaric oxygen therapy to combine it. So it will be difficult for an individual to achieve the pressures that we use in the hospital because these are very specialized chambers, and you would need to basically be monitored and that sort of thing. Now there are standalone chambers that are standalone facilities that patients can go to. I would caution patients to make sure they do their due diligence to make sure that these facilities are doing everything that they need to be doing in terms of safety issues and quality issues, and they have all of these programs up to date. And even if they're accredited, that'd be ideal, because that there are certain facilities that are out there that are willing to treat you with HBO, but unfortunately they don't have those boxes checked, and people can get into trouble. So, and that there have been a couple of cases in the news with that as well. So, I do counsel people to do that. There are portable chambers that you can get at home. Those portable chambers, if it's a chamber without a nasal.
Stop you right there. Start with, there are portable chambers.
Okay.
Go ahead.
There are portable chambers that people can buy themselves, but the pressures that you can attain using a portable chamber is only about 30% greater than.
Oh, really?
So you're really going to go from, say, 100 to 150 millimeters, which is not great. If you use a nasal, an oxygen concentrator in the chamber, that can push you up a little higher to about maybe 300, 400, but you're not going to be able to get those very high pressures that we can generate.
Interesting.
Yeah. Interesting, you talked about mitochondrial. Is there work on mitochondrial efficacy with sauna repair as well? Because there's a lot on HBO and how HBO can improve.
I feel like the mitochondria is the cell. It's like the cells.
It's the powerhouse.
It's the powerhouse. Everyone's focused on it.
Yeah, I think a lot of it is that apoptosis where you're cleaning out, where you're saying, okay, this cell is done. We need to get rid of it. We can improve function on these cells through the wavelengths and kind of getting it back. I don't want to say like getting it back on track, but but really it's that cleaning out and the getting rid of the waste that's not serving but still pulling energy. Something I wanted to mention as you were talking about, getting people sort of on the right track is something that I kind of want to make sure that as we go forward in these podcasts too, that we address. Sometimes it can be really complicated. It can sound really complicated.
Yes.
Like we're doing these really wild out there things, or these supplements, or these procedures, or these things. And it really is things that we would naturally do as humans, right? We would naturally take a bath in the river, which is probably, somewhere between 50 and 60 degrees every day, right? We would be out in the warm sunshine most of the day and
farming,
sweat this stuff off. And so I feel like a lot of the things that, as we talk about different things, I want, kind of the audience to understand that it sounds sometimes more complicated than it really is. And if we sort of take it back to this very, how did we survive, right? I can take it back to caveman years. How did we survive and what did we do, right? And put it into real life practice where you don't need a fancy tub, or you don't have to go to, a fancy.
You don't need a hyperbaric
spa. Well, it is wonderful and definitely has its cases. And I would wonder too, there are all kinds of ancient buildings and different types of healing structures that we don't understand now what they were used for or how they were used. And so I think there may be something in a similar vein that we used millennia ago that we don't understand now. So that's just one kind of point I wanted to.
It's a very valid perspective. As organic beings that came from the soil in many ways, regardless of what religious feeling you have, we have the signatures, the carbon makings of organic creatures. So we are linked to soil, we are linked to cold water. And so I agree with you. There we have become interior building creatures now, but our bodies are not. And so grounding is big now. We never touch soil. We're never in really severe cold. We're never in severe hot. We don't really breathe properly. Now eating organic, I remember one time seeing a sign I was at Whole Foods, another store, it said, organic, which your parents used to just call food. And so I agree with you. We are effectively, as healthcare professionals, not experimenting, trying things in ourselves that brings us closer to that holistic approach to solving a problem. Again, for me, I have arrhythmias. It's a pretty menacing problem. And you've got fancy medication, they can zap your heart, but lo and behold, sitting in ice water, and I've tried everything. I've tried digoxin and flecainide and everything. I've gone to this facility and that facility to zap this and zap that. Meditation helped a little bit. Lo and behold, cold water.
I'm reminded of that statistic that we gave that lecture a few weeks ago about how humans have changed in terms of where they spend their time.
Yes.
100 years ago, humans, 50% of the time, humans were spending their time outside. Mm-hmm. And probably 100 years before that, it was probably
absolutely
90% of the time. Now,
we're sheltered.
Yeah, 90% of the time we're indoors. And so we are breathing in manufactured air to some degree. We are under manufactured light instead of full spectrum light.
Wearing textiles
we're breathing in volatile compounds, which is affecting our respiratory status. This light affects our mental health.
Yes.
So there's a tremendous amount of things that
and we haven't even touched the food source yet. Yes. That'll be another podcast.
Yes, absolutely.
But, Dr. Huberman, who I'm a huge fan of, I was watching one of his podcasts, and he said, studies have shown that 60% of the human's biome is from bacteria, from the soil. 40% is genetics. We've focused so much on the genetics. Oh, you have a disease? Oh, it's genetics. It comes from your family. Show me where, Gary Brecka says this famously, show me where in the genetics you think this is from. If 60% is the biome, cold water, touching soil, hot, it sounds like that's why the gut health is so important. So much of the biome is there. More than half of our body's health is reliant on the biome.
And we touched on this in the last lecture too, how the community plays into that.
Yes.
And it's something that I see so much with, my kids is thankfully they're in many activities and lots of children, but so many of their friends their communication is just a text message,
yes.
right? Yep. And they don't need to get together because they're playing on the game together or texting together. And being in close proximity with people, we're sharing a biome.
Yes, we are.
Right? We're,
yes.
And getting that positive
absolutely
reinforcement. And so much of our foundation is meant to be that
very
community
important
piece too. So that's something I think we should dive into at one point.
Yeah, I love that you referenced our lecture, because I want to let the audience know we do have a lecture series we do monthly. It's on the Frederick Wellbeing YouTube page, and we will reference it in this podcast as well. But I think it's been a great initial podcast. I think we've covered a lot of topics. I learned quite a bit about HBO, and I hope you're both going to go home and jump in some cold water tonight. Yeah. So, well, thank you all for joining us. We'll look forward to our next podcast, and thank you for joining Hot, Cold, and HBO. See you next time.